Because we're gonna call it to order the, what is this, July 14th meeting of the Monroe County Board of Health. Are there any public comments that we're aware of at this point? I guess not.
Tax services, are there any public comments? Any that you see?
There is none.
All right, thank you, Michelle. And we should have Lori Terrell and Dr. George Hegeman joining us if they can be raised to panelists when they arrive.
Sounds good.
Thank you.
Thanks, Michelle. Okay, so pending that, we need approval of the June 9th, 2022 meeting minutes that we got in our packet. Anybody have any changes or corrections?
I went over them. I think I need changes.
Good to me.
Everybody looks okay.
I know.
Maybe one, and that is under 2023 budget priority discussion.
Mhm.
I know we had a chat, Penny had asked us about the different agencies that we fund and our thoughts about those. And I think some of the input that was provided was that rather than just kind of wing it like that, you know, like how much do we think they should get this time? That there should be a more formal cycle of requests, like allow them to request an annual allotment.
But they do.
And we discussed that, and I think
They do request an annual allowance.
We do tell them in the beginning, even of the year, anybody that gets money, that the budget cycle has started. And so that's when they need to make any requests,
Right.
special requests that they have to us.
So we had none.
No actual, this is how much we want. For
Right.
instance, IRA came, right, at the April meeting, and they're told that that's when you would talk about needs, and space was their big need that they had. And so we did the letter to help them move along with that need.
Right.
And then the contract is for 2 years, so they're still in that contract. So it would make sense next year, they may have a financial request to come, and then that would be included in the new contract.
Right, and I think those specific requests ought to be considered, but rather than just kind of, what do you guys think?
yeah, we did discuss that, but
Yeah, like them, they usually come in the fall, don't they? Or they? No,
No, They come usually, they came in January, so they, or February in there. They usually at the beginning of the year give a end of the year report. And then Nancy usually came and or would send a mid-year report. We have not gotten that yet. But yeah,
So what might make it easier are most of our programs that we assist. Do you know if the majority are on the regular calendar year or on the federal calendar year? Fiscal year,
yeah,
yes. I think the majority of them
There-
are annual. aren't
I
they?
think so.
You're mostly, the health department's mostly on the federal schedule. I mean,
The grants
the
are on.
grants are, yeah,
schedule.
okay.
Yeah, I mean, we only
Okay,
have
so it's usually
three-
at the end of the year.
3 contracts that we have that we give money to somebody
Right.
else. Yeah.
One's a not-for-profit, right?
Well, 2 are non-for-profit.
Two-
Well, I guess technically all 3 are,
Really?
because the hospital is a non-for-profit.
that's what
Right,
they said.
yeah. So they're not like on they might be on their own budget cycle,
Yes,
but it's
yeah.
not like a strict federal.
So what I think would be helpful would be to have, at the time that we're actually doing the budget, allotting money, we should be reminded of what that request was for the year, especially if they're requesting it in January. Because
I think that's fair.
Yeah.
Having a list of
And why don't
when.
we hold that till we get to the budget? But we're talking about the minutes right now.
Right.
So
Oh, we're saying, okay.
perhaps
that's
we
true.
could,
That's
what
true.
change would you like to see in the minutes? What would you like us to say?
Just discussion was had regarding formalizing the budget process with regard to agency requests.
Perfect. Is there a second for that change? Do we need a second? Yeah. And I'll entertain a motion to have the minutes.
I would move that we accept the minutes
Thank you.
with that addition.
Thank you. I
I'll
need a second
second
for that. Okay. Steve and Ashley.
I'll second that.
So we just need a vote. Now, I neglected to introduce everybody because I'm tired of doing it mostly, but do we need, since George is here now?
Oh.
Welcome, George. Glad to see you. So we're all here except for
Mhm.
George who's on Zoom. Do we need to do introductions or?
You can just say all board members are present except for Dr. Hegeman, who is via
Although
Zoom.
Dr. Breck, except Dr. Hegel's on Zoom. And so with voting, do we have to do roll call though still since he's on Zoom?
So Lee, with the budget, only those who are present will be able to vote. But what about on things like approving the minutes?
Got a quorum.
Everybody can vote on approving the minutes. It's just the budget that will,
Okay.
yes, you're
All right,
correct.
so then we will do a roll
So we
call.
need to do a roll call since
Yes.
George is on Zoom. So we're gonna start right here.
Yes.
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 Yes,
Yes.
And I say yes, and George.
Yes,
There we go. Unanimously approved. Okay. So next we have public health reports. Do we have Lori yet? I don't.
Yes,
Oh, there
Lori
you are,
is
Lori.
there.
Okay, Lori, you're on.
Hello there. So since last month, we have continued on our outreach programs. We have been working with the Latino population as an identified community group that we're working for wellness screening. June got 50 individuals coming to wellness screening for blood pressure, A1Cs. Unfortunately, we did see about a 90% return for pre-diabetic. So we're kind of looking at ramping up a little bit in some of our outreach, but then also looking at how we can do A1Cs and get them immediate results versus the lab process that takes a little bit of time and tracking them back down to give them the results. So we have purchased an A1C unit and we'll be starting that here in the next couple of weeks once we get everybody trained and up and ready for that. We had both our COVID state vaccine site review and our VFC site review. Both of those came back with very glowing results, no remedial action needed for any of the vaccine processes that we have. We are in the process through Zara working with Joe to get our back to school clinics scheduled. We are planning on the fall group to add in any immunization in addition to flu and COVID, because we know that there were a lot of kids who kind of got out of getting all their vaccinations in with the COVID period. So we're trying to help the schools by capturing those in their first school requirement days. And then we'll of course be back there in the fall for the next rounding as well. We are working with our VaxCare system, which is where we document our immunizations from the charge entry point to be an electronic integration into CHIRP. Right now there is manual entry into both systems. So we're trying to remove the duplicative work and make it a little more streamlined. Few bobbles have been there, mostly with the COVID and the communication between the two systems of the 0.25 dosing for third and fourth doses. So it's made a little bit of an inventory issue on the COVID, which we're working through that between the two vendors. We are working on installation of the generator for the Helmer refrigerators and vaccine and freezers for the vaccines. So that is set. They were there again working today. So we are hoping in the next 2 weeks to have that in place. So we have security-based additional supports for all the vaccines that we have housed. We've added in Pfizer vaccines for 6 months all the way through. So now we have been vaccinating for the 6 month to 4 years and then 5 year to 12 year as well. That started a couple weeks ago. We know locally Riley Physicians has the Moderna product. So we right now have just the Pfizer product to try to help avoid risk of errors for more vaccines, because we do have Moderna, Pfizer, J&J for the adult population. And then we were really busy for the first couple of weeks until Riley Physicians got up and started vaccinating their group. So we have seen those numbers for the little ones go back off, but we still remained busy with other vaccines for that. We had our new hours that started this month, which gives extended hours till 6 p.m. on Mondays, and then the second Saturday of every month. So we are now opening and starting those extended hours. We received notice from IDOH that they have mailed out about 50,000 plus letters to individuals for young children who are behind on immunization series. And so we have already started seeing an uptick in the calls for those. Just unfortunately, the letters just say your child's behind on an immunization, doesn't say what. So getting them in, getting them scheduled for those. And then, of course, working with preparation for monkeypox. What does that look like in terms of following for communicable disease follow-up? And just making sure that we're available for those resources, and when vaccine comes available in need, being ready to support that.
Anybody have any questions for Lori? Saying none. Thank you, Lori.
All right, thank
Lori.
you.
See you next time.
Okay.
Okay. And then we have administration, just Penny and
And we're
Lori.
gonna tag team tonight, so
Fun.
Lori is gonna give you the administrative updates.
Yes. Okay, so it looks like, so to start off with, interviews are in process for both the clinical and environmental health positions. Next key point, Ashley, Rocky, and their teams have been working hard on the fee code and the septic code. These should be completed by August.
Hey, Lori, can we go back one? Is the
Yeah.
environmental health position, is that part-time? Or is that full-
Temporary,
It's a
full-time.
Okay, temporary full-time, but we're gonna want, okay, I got you. All right. Thank you.
Let's see. The kickoff meeting for the Community Health Improvement Plan was held today. They had good attendance. The staff do plan to attend the meeting in August to give the board further updates on the details of that event. The reports that I got were that 15 attended via Zoom and 37 attended in person. And they had at least 8 individuals in attendance that are planning to participate in community work groups. And they're looking to expand that as well.
Great.
For COVID updates, COVID levels are increasing across the country, but numbers are really staying pretty steady within the county. We haven't seen any big fluctuations.
Transmission's high, but it's not, going up. Quickly,
Hospitalizations and stuff like
Yep,
that.
they're staying pretty We've had a little bit of an increase in hospitalizations. That's kind of why we're at medium level, but nothing big,
And we can
no
attribute
big-
that to,
mostly age and underlying health conditions.
why meant the low numbers, vaccines.
I-
Low-
that-
holding
Well,
steady.
certainly that has a lot to do with it. The new, the subvariants are certainly, again, easier to transmit. And so seeing some difference in, the vaccines are still effective against severe disease and hospitalizations, but maybe not always as effective against infection.
I tell you how many times I've had that conversation
Mhm.
with people. Like, vaccines don't work. Yes, they do. They work.
Well, that's kind of why I
You're
thought
not
we
dead,
might
are
bring
you?
it up.
Yeah.
I thought I might bring that point up
Mhm.
because
Yeah.
with the variants, we'll probably be getting additional vaccines down the road, similar to the way the flu vaccine is administered and studied and all of
Yep.
that. So it's still really important to get vaccinated. And so we can
Right.
keep our numbers.
And get the booster.
Get the
They,
booster.
they are looking at, we've not really heard any details yet, but certainly are looking at what that next fall booster might look like in terms of what it should be directed toward. So we'll hear more about that, I'm sure.
Pfizer's tweaking theirs.
Yeah, I read that. Okay. That monkeypox too. So.
That's right.
And then brain amoeba is coming. in. So it's just- I was just not leaving the house.
It's just some really good stuff coming down the pike.
Sorry to interrupt you, Lori, but
Oh, no.
I did want to point out about the vaccines because we do want our residents to continue getting vaccinated and doing their boosters.
Yeah, and they need to remember the difference between transmission and severity of disease. So, it's easier to get, but you just don't get as sick.
And I've had
they're-
COVID. I was out
And
for,
vaccines are part of.
5
it.
days.
Yeah.
I was down for 5 days and just it wasn't horrible at all, so. I was just not allowed to go to work, is what it was, but, yeah, so, I mean, comparable to, nothing close to a hospital requirement, or even the doctor, frankly.
Glad you
Yeah.
bounced back.
Yeah.
We're glad you're here, yes. I think that the frightening thing about it is that I mean, I know a lot of people have had COVID,
Mm.
including people in this room, and nobody knows, has any idea where they actually got it. I mean, a few
Right.
people know, it came from a big group, but I mean, these are people who, do everything right, go to mass to the grocery store and go only hang out with people who are vaccinated, but, and they have no idea where they got it. But most of them were not terribly ill. So,
Yeah, it's not something that, it's not like some of the other things that are much easier to track back where you
yeah,
got it.
Right,
The vaccinated people, of course, can have it transmissible.
right.
Give it to you, and they don't notice a thing, but you do.
Yeah,
okay, anyway, all
You
right.
remember back during the early days, we were actually doing contact tracing with COVID?
Yeah.
Can you believe that?
Well, because
Back
you
in the
don't know
days,
when
it wasn't
you
that long
don't know.
ago.
Yeah.
I like how you said that, though, Mark.
Like,
We were back
way
in the
back
days.
way back in the day.
There were no vaccines then, and people were dying.
And we
Yeah,
didn't know
yeah.
what we were dealing with, right?
Right.
But
And then all of a sudden, boom, like you couldn't even, there was no chance.
yeah,
Well, it's contact tracing is very difficult at this point since there's so many home tests. I mean, I just did one, so I mean, I've done like, I can't even tell you how many home tests. I've
yeah.
done.
Well, and the home
Those are
tests,
called
we
the old
know
ones.
that what's reported,
I
that
remember,
we
man.
still have high numbers. So you know that it's circulating. You
Exactly.
don't need all of them to be reported for that. Just like contact tracing, you do it in the beginning so you can learn
Yeah.
how it's transmitted, what's going on, and then you reach a point where it's not so effective.
Are we wanting the public to report?
No.
Okay, didn't think so.
No.
Just keep our fingers crossed we won't get a new branch come out, a new.
Yeah.
New version.
Stay vigilant. Get your
I think I
vaccines.
read this morning, was it in this morning's paper that they're estimating that only 1 out of 7 positive cases is reported formally. They're just all home tests. Now.
I can
Maybe.
believe that. This
I
is
can
one.
believe that.
Only 1
now.
out of 7.
Yeah.
So anyway, stay with me, please, don't know.
7 staying cool.
Okay. So that was really just about all that I was going to hit on, unless there are specific questions or.
Anybody?
That was good. Nice.
That you do have our after action report. Those are some printed copies.
I was
If
like,
you,
yeah, I want to do that.
there should have been
So easy.
enough for everybody to have one, so you're welcome to take
Yeah,
that
I
with
like
you.
Read
I
this.
like this.
This
You guys
is
are
a
getting
lot of
so
work. This
fancy.
is really, really good.
You guys are getting
Yeah,
fancy.
and
I trouble
money
with-
well spent, because we paid to have that help, and we could not have done that on our own.
Well, this is really important for the future. It's really, really important.
Well, and I think we may have talked about this before, but the improvement plan portion, those things that are things that we can do will be included in the next preparedness grant as deliverables that we have to accomplish in order to meet the deliverables and get the grant money. So,
We certainly learned a lot through this pandemic, which is not endemic, but, and I think that all levels of society have learned things, and hopefully we'll be in a better position, because we will have another one.
Yeah.
There's no doubt about it. And it may not be
Always
100 years,
something.
it might be 2 years, I mean, who knows, but
Public health officials knew that we'd have this one. They just didn't know when it was going to be, and then they had no idea how woefully prepared we were.
yeah.
So,
When I
Yeah.
think back to Ebola, when it was raging throughout the globe, that our country just did an amazing job of keeping it out. And, I know that was our hope with this, and with monkeypox coming around too.
Yeah.
We're just our total.
It is, it's not as easily transmissible.
right?
That's the good news.
Yeah, right?
So,
Yeah, you
yeah.
gotta be up close and personal there.
So, okay, anything else from Lori or anything?
Thanks, Lord.
Okay, so we can move on to the budget.
All right, so Kendra is going to share the screen so we can show you the budget spreadsheet up on the screen. So if you, yeah, we'll have, let me adjust.
I see the screen.
Oops.
I'm trying to
No, wait a minute. I took you away, I think. Did I do that?
I don't know. Do you need me to come in there and look?
Oh, hang on.
That's scary.
Yeah, she says it's easy because I don't need those.
Oh. Need to
yeah.
figure out how to enlarge it.
Where that at?
No kidding.
I'm coming in there, but
Okay,
Give me extra budgets.
we,
Print one?
I can have her print some too.
Okay.
We can.
Especially I love the paper saving thing.
Dropbox.
I'll go.
Yeah.
Can you?
It is small.
Yeah,
I guess I
it
could-
was bigger, but our pictures were on it. And then when I went to move them, it went away.
I know we're getting so techy.
Does
Although I
everyone
feel like
want
that,
a copy or just?
I would love a copy.
I actually would for why you.
I just
note
see it so much.
taking.
That's something.
Print it off your computer.
Well, it's.
Kendra, I think you might have to do it on yours since you're sharing.
Yeah.
yeah, oh,
I'll
duh.
give you, it's,
Yeah.
the typeset's
Sorry.
a little rough,
And I find to read it
You
back
do
and
like
forth, but
Arial or
we need more
something
from my
that's,
screen.
you know?
Yeah, so when
It's
I
pretty,
started this
Yeah.
week,
but it's not the easiest to look at.
$100,000 budget.
I think when you do it on yours,
Yeah, I'll be able to zoom in.
yeah.
Hey, I was prepared.
I brought it and I thought, why am I bringing it? Shove it all in there. I had notes with
Well, you know, I couldn't see it all on one screen. I had to roll back for it, so it's making me dizzy. So I can't read that. I tend to think paper is just okay. Not for everything.
No.
Okay, is it zooming in for you guys?
Yes, yes.
Yeah,
There you go.
Cool.
Yeah.
Glasses.
You did that the other day.
Wrong glasses.
Yes.
Were you at the golf course before you came here?
No,
I was gonna say that might be why.
no, I was just driving. I have 3 pair in my car. And this is what I picked up. I took the golf course. Little snap.
So sorry.
weather was good for it today.
Oh, it was, yeah. Great weather.
My children were here this weekend and we played IU on Friday.
It was nice seeing your daughter, by the way.
Yeah, it was fun. having her.
She looks good. Looks like she's doing well
Thank you.
and seemed very positive. And,
He played IU when she was in high school and all that stuff, and now it's totally different.
oh, yeah. Yeah. Yeah, it's gone from pretty
Weeds to
easy
weeds.
to not so easy. What'd she say?
Well, she liked the contour of the course and things, but you have to play it more than one time to figure out where you want to go.
Oh,
And the
yeah.
weeds were everywhere, the grass,
Oh, yeah.
sand traps.
Yeah.
She's not playing a whole lot of golf now, but she started to get back into it.
Good. Yeah. Where's she living now?
Atlanta. She has a boyfriend who plays golf too, so they're really.
Oh,
Okay. That helped a lot. You got
Oh,
the-
look, it's the bunch of-
No, we should have 2, right? Or a couple.
You should have several pages.
So here we go.
One
All
packet,
right.
several.
I think we should just do these one at a time. Good decision.
That's what we usually do.
So we're gonna start out with, 11:59.
Sure.
We'll start there.
So.
I love your notes.
Yeah, so what I tried to do is just hit the high points. Remember that in terms of personnel, that county council sets the compensation policy, the insurance, those kinds of things. So we don't really have any control over increasing those. But we wanted you to see what we have and the things that actually we are looking at adjusting. So we wanted to request that the temporary environmental health services, environmental health specialist position that we've had now for a couple of years, that we request that become permanent. So far, two council people that I've talked to already thought that it was already permanent. So I think hopefully that will be an easy ask. We certainly have utilized them. We still need them. They're very busy. So I think that it's a very reasonable request to keep them in there. It was in the budget. So we will just try to make that official. And the one thing that we are looking to do, and we're doing this now that we have a position open and we moved some people around with the team lead in foods leaving. We promoted one of the other folks into that position. So we've done some internal movement. But we want to make sure that anybody coming into the Environmental Health Services Division is thoroughly cross-trained when they come in. And that will give us the ability to move people around if we need to, or if we need extra backup for something. But also when vacancies come, you have people who are more trained and not just in terms of seniority. Because in the past, people were very specialized. And so somebody might leave, they might want to make that switch, but what they have is seniority in the department, but they don't necessarily have those particular skills or training. And so this would mean that they have that. So we have a better path for that growth career.
Yeah,
So
really important.
that is the plan.
Good.
The part-time hours, we are recommending that we keep those the same.
What line is that?
That is,
Oh, I said 17,801.
yes,
And where was the environmental health position?
it is 10181.
Oh, 8-1.
Okay.
101,801.
There's no line for it, but there's a line for the next year.
Yeah, well, it just started in 2021.
Okay.
So those first ones are blank because it
Okay.
didn't
And
exist.
so it's
Yeah,
going, working part-time to full-time. Okay,
Yeah,
Oh, okay,
it's
so-
full-time now, but it's temporary.
right.
And so it would just be that temporary note there. It doesn't change the job description.
Right.
Job description's the same. It's just that status moving.
Yeah, you
So-
see between 21 and
Yeah.
22 there. Okay,
In fact,
got
they
it.
didn't know it was part-time. Didn't you tell me that?
Temporary.
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 Yeah. I had a couple people say, oh, I didn't realize it was still temporary.
Okay,
So,
all right,
I think they'll all agree that it's a
Yes.
necessity.
yeah.
okay.
And then part-time staying the same.
Part-time staying the same. We do struggle so with kind of keeping all those part-time positions filled, and with COVID, we added some and that kind of thing. But I think that if the other thought that we had is going forward into like next year and into 2024, might be able to take some of those part-time funds and instead of having 3 part-time positions, have 1 full-time position.
Mhm.
So we might be able to ask, that would be a new position ask, and we'd have to go through PAC, which is a council process to get that done. But so I would not lower that
Right.
part-time salary, but I think that that could be part of the response is we could use some of those funds if we needed to offset a new staff
So, and
person.
the year-to-date spend on that line is fairly low. Is that?
Yes.
You don't have anybody to pay? I mean, are they positions that you
Yeah.
fill, or what is it?
It's a variety. A lot of it is keeping those part-time positions filled. With COVID, we didn't continue having all of those response to call staff. So we had those earlier. And those numbers were increased. Remember that that's also where that we had our part-time soil scientist and then the soil scientist assistant. We've had some changeover there.
Yeah.
But yeah, and then at one point to the county, was it 1 or 2 years ago, they increased starting salaries for part-time to $14. And so at that time, they increased everybody's part-time hourly as well.
So I guess I'm concerned that if you look at the years, like, 21 to 21, we didn't spend it all. and,
Right.
And we have a lot allocated for that. Are they gonna
Right.
get annoyed by that?
Well, that's sort of to my point of don't lower it because
Right,
we
okay.
may be coming to you and those funds could actually be moved into a full-time line.
And a pro tip, the council, they want you to keep it flat from the year before.
Okay.
So they'll be expecting it to be the same,
Okay.
okay?
I just, if I were looking at this, there's somebody say, well, wait.
Right.
No,
But I'm just trying to-
absolutely,
what-
absolutely
yeah.
good
And you
question.
two have a very nice defense
As long
for
as
it.
you have a defense for it.
How many individuals are right now in part-time classification? Like, give me an idea of how many people we're talking, how many bodies we're talking about from time to time.
Well, from time to time.
Yeah.
So it could be any, so some of those could be seasonal, so it could be anywhere from 2 to 5.
2 to 5.
Mhm.
Thank you.
And the hours that they work could vary as well.
Okay.
Do you guys, have you thought about what kind of position that might? cover?
Yes, our thought is, again, to, one of the things when staff have talked about with environmental health services is having somebody who really knows and is in the office all the time to answer questions, because they are field staff, right? So they're out in the field, somebody comes in, they're asking vital record staff, they don't necessarily know the answer. So the thought that we had is you could come in, again, you could cross-train somebody, they can do the field work, they would be the environmental health specialist, but perhaps they're an entry-level PAT instead of, they're PAT A instead of a PAT B, and they're mainly in the office, and they're learning that office and taking the money for permits, processing permits, those kinds of things, but they can also go out in the field as needed. And again, then you've got a path for movement up in the department as positions might become vacant.
So when you're talking about your cross-training for this specific position, would everybody have a day in the office? Could you just schedule one of your employees to, you're in office day today, you
You
don't
could.
schedule,
You
don't
could,
schedule any on-site
well,
visits? or
you could,
field
but I would
visits?
say that would be an internal staff and division manager decision on how they wanted to do that.
In the office.
But
okay,
my, I guess part of my thought for that was sort of that upward movement, that when people come
Right.
in today, they want to see that there's potential for growth.
Absolutely.
And if everybody is if everybody's a PAT C or a PAT B, there's no
There you go.
where to go. And so that might be an opportunity for them to have that growth.
Yeah, that's great. Actually, it's good thinking. That's the way we should be doing it. Because that's why we're losing a lot of people.
Mhm.
Yeah.
So,
What's next?
okay.
The next
And
page.
I think that's everything, I believe, in the personnel lines. We did go through and kind of look at what we've done over the past 3 years, kind of what's that average we've been spending, where are we at now? We were a little surprised by our fuel and gas lines.
kidding.
That was a little interesting, and I don't have a good answer for that. Maybe we're just routing things really well, right? The fuel line, and so that is,
For efficiency.
yeah, 20100. We're on track, we're good. We're not looking to deplete that. If you look how we're trending, we could increase that a little bit. I know you talked, Dr. Pritchard, about wanting to maybe increase that. So we certainly could. That line is for our fleet vehicles. So the fuel line is for the county vehicles that we have, and they get fuel at the highway garage and we pay for that. The training and travel has the mileage reimbursement in it. So at this time, we don't have an increase in that line. We, let me,
I mean, most of our fleet's pretty new.
Is it
for
that was-
now.
is
Yeah.
it
Yeah.
just better?
We
better
bought
gas mileage?
vehicles.
yeah, that could be it too, but we were,
Getting rid
let
of
me
the
look at my
Jimmys,
notes,
the
ready to get
GMCs,
to-
Buy
and-
hybrids.
yeah, but we could, and when we come to this other of it, it could be.
Seriously.
Let me look at the right.
I'd support that. And I think, I know the commissioners would.
Right.
Trying
For
to-
an for an SUV. it's
But
great.
right now, we're trending to spend like 3,000 out of that 5.
Okay.
So that's why we
think
didn't
that's fine.
suggest.
What's your year to
Increase
date?
in-
Is that a June 30th?
Yes.
Okay. Because an actual half a year.
Mhm.
Okay.
Yeah. Then when we look at environmental health supplies, we did increase that some. We had a request from wastewater for a leveling tool that they needed. And we did ask staff, what are your needs? What are your wants? And those have been factored in these decisions as well. So that is why that went up. So,
Just $500.
yes. Yeah. Then we have one you will see at the bottom there, staff apparel, and
Yes.
this has come with a request and debate. Every health department does this differently. It's been hard trying to kind of figure it out. So we've used that uniform line, wastewater staff, for example, if they needed new boots, we did that. But it's typically been, a t-shirt or jacket that you might need, things like that. Some counties don't provide any kind of boots, wear like that. A few might, but there were very few that really did. So we've had we will reimburse you up to $125. So we've had a request to increase that. We've done some research, talking with other counties. We've talked with the county auditor about it as well. And their recommendation was really to just look at having kind of a stipend that, for instance, every 2 years, they could have $250 to spend on boots. If they wanted specialty gloves above what we provide, if they wanted, say, rain wear, special, pants to cover what they're wearing, then they could pick out what they wanted using those funds, right? And that was the proposal, so that anybody who is assigned primarily to the wastewater division would get that stipend every other year.
This is basically for wastewater.
Yes,
Okay.
because they're the ones really
So,
slopping in the muck.
I do have an apparel question. Do
Yeah.
we have like a
Logo.
some sort of apparel that they could wear would identify who they are, like a
Right.
polo shirt? or-
We do have, and this is the interesting thing. So we've got these uniform lines, but usually it's grant funds that pay for departments to get a t-shirt or something. So we do have, staff have polos. We've had various types of shirts over the years.
Yeah.
And that's what that uniform line is usually used for.
I think it's really nice.
Or something would be good to have with.
Especially if people are out in the field.
Yeah.
To have somebody identifies who they are, like, you got to be on the back of your shirt.
Right.
Well, that's exactly what I was
Yeah.
thinking about. Like, everybody gets a
Yeah.
windbreaker
So
with the
we
logo.
do have windbreakers that came from H1N1 money that have big bold health on the back of it. But some of the field staff in the past, for example, had like more of a winter type jacket that had our logo on it as well.
Yeah. I think it's just nice to have the
Well, and
opportunity.
it's safety too.
And
That's really important.
yeah, so
Yeah.
part of our thought, we had a lot of discussion about this, was keep the uniform line for things like that, like things that might be given to all staff. That would be your uniform line, but this other, and we may need to tweak and come up with a better name for that, but that was just what was plugged in.
You put wastewater apparel.
It could
I think
be.
that's what it, because that's what you're saying. it is. I
You
would
know,
just make it wastewater
Under
apparel.
apparel, well,
That would explain it.
Yeah.
I mean, if I were doing wastewater, I would like apparel.
So have all these lines already been created? Is that like? Or have you gone through that process yet? I mean, are you gonna have to do that at your council meeting?
No,
Like,
well,
27150, I mean.
yeah,
I
we,
forget how this works.
yeah, we'll have to ask for that line
For
to
that
be
line, okay.
added,
That's what I
yes.
thought.
I would
That was-
change
that's
it.
what
I
my
really would
Yeah,
change
we,
it to make
we
it
do
clear.
not intend to use that name,
I
but
would really make it wastewater apparel. 'Cause that makes it very clear what it is, and I don't think anyone's gonna argue with that one.
I don't think so either, honestly.
I mean, you want to tell somebody not to wear boots? I mean, come on.
that came up because we had our financial manager just look at some of the
Yeah.
categories
Well, that's
and
good.
see what's already there. We were trying to find
I think
something,
that's a
so
good category.
it's a
I like it.
placeholder, yeah.
I do like it.
So-
Yeah, I would, yeah, rename that.
Are you good with that? Just in general, are there other thoughts about that amount or?
Okay, so that's the only line we're adding. this
Yes.
year, for-
In the
on-
20s.
On the,
Yeah.
in the 20s, right? Okay.
Yes,
All
and
right.
it may be the only,
Yeah,
yeah.
you're just upping some of the other stuff a little bit.
Yeah.
Okay.
Penny, the
Okay,
only
well-
question I had is under the line item medical supplies.
Yes.
What types of things? I mean, to me, that seems like such a small amount, thinking of COVID and all the things we
Mhm.
had and so forth.
Right. So that line was mostly used for when we had the STD program in the health fund. And since it is in its own fund now, we really don't use that much. But we did just kind of what you're talking about, didn't want to deplete it. We
Right.
want to keep some money in there in case we need medical supplies.
And that line.
Most of the medical supply side of things will come from the public health clinic and their funds, right? Or we've had preparedness funds for some things. So it just kind of depends. We've had a lot of grant money this year to cover a lot of extra expenses as well. But that's why in the past, maybe it's been higher but we don't want to take it away. We want to have some money in there in case we need something. And you mentioned Ebola. We still have a little bit of money that we got during Ebola that had to be used for communicable disease that we kind of set back aside. So if we had another expense, we could use some of that too. And we've been lucky enough that, for instance, COVID brought additional funds. We didn't have to tap into that because that's what we would have used up first.
Okay. Any other questions for the 20 lines, anybody? On to the 30s.
Okay. So the big ones in the 30s. Yeah. So again, most of those things are just pretty basic. I think training and travel, we suggested $2,000 increase. Again, we're not looking to use all of that this year. Now with trainings and those kinds of things kind of picking back up with adding staff, then in 2024, it may need even more, or we'll have to come up with a different policy about determining who goes where. Right now, we're pretty liberal about there's a training that is essential, is related to your work. We want you to go, right? And so we try to do that as much as we can. We had some others like postage and freight. We increased a little bit. I believe that was one as well. And that goes back to that gas too, that paying for postage is going up and freight costs if you're shipping something are going up. So I want to talk for a minute about assessment and accreditation. And they're not back to back there, but those two lines are for the things related to us becoming an accredited health department. We just finished the assessment, so we can lower that a little bit. We don't need as much money in there. But we did use that line for our after action report. That was an assessment of what we did, right? And so we did use some of those monies for that. So we don't want to zero that out this year. The accreditation related services, we are looking to increase that. And I bet you, I didn't have, so the new costs for accreditation are out. So they've changed things a little bit about how they do the process. So now when you think you're ready, you pay $1,300 for a readiness training that they call it. What they had was a lot of health departments saying, we want to push that button, we want to do this, and then they really weren't ready, right? So we're going to walk you through, make sure you're really ready before you get there. And after that, so we hit that button in our strategic plan. It's kind of like January, we hope to do that training and say we want to start this process. So we get through that and it looks like we're ready, then it is $14,000 a year. And so that's the increase in that line, right? And
$14,000 per year?
Per year.
Like, what is
Yes.
what is the cycle though? 3 years?
5 years.
But they charge you 14,000 every year.
That's why a lot of counties can't do it.
Mhm.
It's ridiculous.
Yeah, it is based on your population. And it can, change, over time, but it is 14,000. Now, I will tell you that you'll see another new line at the bottom. I'll wait and tell you that. So I do think we have some revenue that we could put towards that if we need to. If we need to.
All right, so
Oh, yes.
So-
Jamie sent a message. She doesn't have audio. The staff apparel line, it already exists. They just have to, that currently exists in Lao. We would have to request them to create a new line, is what she said.
Okay, but it just doesn't exist in our, thank you.
Uh-huh.
So with the money in there for the actual accreditation fee,
Mhm.
that is a statement of intent.
Yes,
That's saying next year, we're doing it. Like this.
We've been working on it
it's a
10
big
years.
thing.
it's in the strategic plan, so.
It was been like 10 years we've been working on that.
And we've been
It
kind of
is.
plowing that ground and we're almost there.
That's very exciting.
It is.
Yes.
Yep.
Okay.
So that's why those are the way they are.
Okay.
In personal health care, that is the line that you all were talking about. So it talks about IU Health, our contract with the public health clinic. And we did not get a specific request. Now, if you remember a few years ago, in 18 or 19, they had a big request, like $10,000 a year and for so many years or whatever. We gave them, I think, a good percentage, and then we've been, over the past few years, increasing it a few percent at a time, and that's been very agreeable to them. Of course, we've also had a lot the last year or two of extra grant funds that have went to them. So this does include a 2%. I did round it up $1 or $2, but a 2% increase to the public health clinic. It does not include additional money to the Indiana Recovery Alliance. Again, would stay at 20,000. We are in that contract with them. And then hopefully next spring, they would make their ask. And then as we're working on the contract, that could all be built in.
And that does come out of the personal health care line. Okay, gotcha.
Yeah. And then we have a little bit of extra money in there this year. I think it's 4,000 that we had identified for other needs. So it might be a health department need, but it could be an ask from another agency for something that we felt like we could give them something.
Right.
And so I'm just suggesting $6,000 for that. So it
Okay.
is an increase from this year, but not much.
Okay.
So
To go back to Mark's point earlier, and since we're discussing this, I think it's a fabulous idea to have an overview of our partners and where we are with the current contracts and how much they get from us each year during budget time, so that we can visually and kind of understand where the money's going a little bit better.
So what do you want different than, so when you have the budget, do you want us to break down those amounts more for you?
I think that's what we were asking, was just to, on an annual basis, kind of just allow us to review how much we've given IU. And and then what amount is the budget, the budget amount that's budgeted for this one. And then the recovery IRA, make a note in there because they are partners that they renew in 2023 and they had a $20,000. So I think it'll help us in terms of adding up and understanding what that balance means there.
And specifically how the money's being used.
Yeah, and then maybe a summary.
Well, that's why, so
And a summary.
Indiana Recovery Alliance is, and so if you want to do this differently, that's why they're invited to come in the spring to give their report. So January or April,
Right.
if you're meeting monthly, it could be anywhere in there, right? But to give their kind of end of the year report and what are their needs for the next year. Health Net the same way, your end of the year report, what is your additional ask?
What's the deal with Health Net? Is there any change in the budget there with Health Net?
It's not in this budget.
It's a different.
It's a
different
budget fund. It's a different fund.
See, I guess that would be helpful too. I mean,
Yeah.
you know, just with our partners, because like honestly, I don't even know who they all, who they all are. I mean, it's hard to keep track. I
Well,
mean, I know we have
it's-
some at the end of the year
it's
that come. If
Community
we could
Health,
just have a
IRA,
spreadsheet list
and
of them,
Health
and
Net.
Health Net.
that would be helpful, I
Yeah.
think.
Okay.
Especially when people accuse us of not doing anything.
Public health, IRA, our part of the personal health care budget, but not health net.
Correct.
It's a different budget.
Yeah.
Because it's
So,
paid
and
out
that
of
would
local
be
health
helpful.
maintenance
Oh,
fund.
that's right. that's
Yeah,
So we
right.
can
and
put
that is
on
in
there.
here.
Yeah.
It is in your,
Right, I remember that.
it is.
Oh,
in-
yeah,
We'll be
I
getting
know.
to that.
We're talking about cheat sheet though.
Yeah.
One sheet that we get a budget time, that just kind of is a review of.
Yeah.
Like a summary
A
breakdown.
summary breakdown,
Like the
just that goes,
bullet
attaches with
points.
our budgets each year of our partners and
How they're using. the
what they're
money.
using the money, how much we've given them and how they're using it. Just so it's kind of always top of the mind. Plus it'll be nice to just have it in our folders
Yeah.
too.
Okay, my suggestion is that that's not the, right, that is what the April or the June meeting was intended for.
Because
To have that, so you could provide,
Right.
how do you want us to prepare the budget for this meeting?
I agree with that.
Okay, so
Yeah.
then it should have been that. Okay, so then we can whip it back out.
So.
So if we had gotten it in April, we could be
That's
whipping
April.
it back out.
Well, and that's what we talked about in
Okay.
in June,
Right.
and
Yeah.
that's
Yeah.
why
That's why it's all
IRA
kinda coming
came
back.
in
I
April.
remember.
Right,
Mhm.
you know, so
Yep.
April should be our month to talk about how we want to do things differently in the budget. And then July is when we do the budget.
And maybe
who
Health
knows-
Net.
Yeah, if you're meeting quarterly,
Who
yeah.
knows what kind of meetings, we'll
Yeah.
discuss that later.
Yeah.
It's been a while since we've heard from Health Net
Mhm.
face to face too. I mean, that,
January, right?
Yeah,
was it?
January, February, yeah.
Oh,
Yeah.
Maybe I
It was
missed that.
February, because,
Okay.
yeah, it was, but yeah, it was beginning of the year.
Yeah, but it's, I agree with you. It's nice in April, we're starting to talk about things that
Yes.
change, but to have a
We
little
get that
summary
then.
of the presentations that we've had, just so
Yeah.
that.
Or
Yeah,
who
To
might
remind
be
our old
coming.
brains what's happened.
Yeah.
Not yours,
Yeah,
Mark,
I
rest
think
of ours.
that would be really, I think that would be.
Not
super
your brain.
helpful. Yeah, and I think that's kind of what we were discussing. It would be good, because then I
Okay.
could have brought it.
There we go. All right, I think we've beaten that one. All right, next line, Vaxcare.
VaxCare. So Lori talked about VaxCare when she was talking about her report. So and this started years ago, and it goes, kind of funnels through the health department. The Indiana Department of Health arranged for VaxCare and local health departments to have this agreement to do third-party billing. So they do the billing for vaccines that are not, so at the public health clinic, if you are getting free vaccine, like vaccine for children, then that's free. You're using those vaccines. So they have to keep all these vaccines separate. But if you don't qualify for vaccine for children, or one of the free vaccines, then the hospital has other vaccine that we order through VaxCare. And if you have insurance or some sort of third-party payer, then VaxCare will do that billing for us, right? And then we get that money back. So it's for the administration fee, right? If,
What percent do they get, do you know?
you know what, I don't know exactly. I mean, they take a cut, obviously,
I just wonder
off
how
the
big their cut
top.
was.
I think it might be, it's somewhere between $8 and $12, I think now, but
Per-
it varies
per
per
billing. Per
vaccine.
billing.
Yeah,
It's not a percent, it's a per billing.
yeah, and it does vary, I think, by vaccine, what it is too. I'm not sure exactly about that, but they did this year start billing Medicaid, and that was huge. You know, we've been trying to figure out how can we do that. We had tried with the public health clinic and we ran into barriers because of our relationship. It was, billing and so forth. So the fact that VaxCare bills Medicaid now is huge. It's also increasing the revenue that we get.
That's right.
Right. And
So where does the
so,
revenue go to then?
well, so when we set that up, because the clinic is actually administering it, but we have to process everything. They get 80% and we keep 20% for sort of that
Of what-
management,
of what Vax Cares
administrative
take.
of what we get in terms of revenue from
Okay,
Vax Care. So the
okay.
money that comes then is split and we send 80% to the public health clinic.
So the health department does get some.
Yes,
So that's good.
yeah,
20.
That's good.
yeah,
Right.
not a ton, but
Right.
we get, yeah.
Okay.
And that's increasing. So that, that we started out when we first started the program, I think we put $10,000 in there and we kept lowering it because we weren't getting very much money back. If we have a period where we don't get any revenue, but we have a bill, so, then the hospital picks that up as part of their community benefit. So we don't pay for that.
$1.4 billion. Oh, good.
That's
So,
nice.
Maybe it's
So we don't pay for any of that, but we share the money that comes back in.
Right, well, thank you.
So,
That's nice.
all right. So that is
Okay.
Vax Care. All right. Then immunization expense.
That's a fun one.
That is a really fun one. So this year, you heard us probably complain about Zotec, the scheduling system for all the COVID tests and everything, and love-hate relationship, right? But they did billing on behalf of all the local health departments. So the state and Zotec worked out this. So we're getting it comes to us kind of through a grant process, but that's because the state only could use that process to get us the money back. So it's not a true grant, but they billed for 20 and 21, everything that was in our public health clinics, including the clinic at Assembly Hall. So
So is this all COVID related?
that, yes,
It's all COVID related.
and that is
The immunization expenses.
our portion, the 20%. Because we were able to split, and now I don't have it from me, I think 327,000 to IU for the vaccines that they did at Assembly Hall on our behalf. And then the public health clinic got 219,000, and there's change, but 219,000. So that 168 is our portion. So that's the money that I was saying, if
Try not to smile.
council were to balk at our accreditation, we could use some of those funds to offset our accreditation, because we put it in there as immunization expense. We've got to come up with something. We already had that line in some of our budgets,
Okay.
but we could move it and use
So
it for
we got
something
the money,
else.
and that's what the money is.
So you
there.
can move
So
it around.
It's
in
an
the
expense,
30.
but we actually have the money.
We do have the money,
Okay.
and the reason that I want it in that line is I don't want it to get lost in cash balance
Right.
and our tax levy go down because we're sitting on that money as cash
Okay.
balance.
All right, so it's a good plan.
Well, but we also have to reiterate how important accreditation is.
Mhm.
Yeah,
Because
they-
that
they
that
can't-
comes
they can't
first.
Talk at that.
They can't walk out. There's too much work has gone into this.
Is there anything else on the 1159 budget?
I think those are the big things. Lori, can you think of anything else that we missed, or?
And does anybody have any questions? Any more questions?
The only other thing that I will add is just know that bottom dollar will change because council will change salaries.
Right.
They already changed insurance costs are 12,000 per employee, but that's in there.
So yeah, your budget in the tens doesn't include the upticks that anybody might have. or
It does not,
It does
because we
not.
don't know what
Okay,
they will
that's-
be.
That's up to them. So,
Mhm.
Okay.
okay.
Yeah.
So if we are asking, I believe, for a new vehicle this year,
That will be in an
That's a different
upcoming fund.
Yeah, why don't we vote on this one, get this
Yeah.
one done, and we'll move on to the local.
Good job, we got new vehicles. Maintenance.
That's a different.
I know, right?
That's what, yeah, I think those might be correlated.
Mhm.
Oh, sure.
We're gonna vote on this one.
Yes, let's do it.
Okay, we have a motion to accept this budget as written. Please.
I so moved.
Thank you, Mark. Have a second?
Second,
Okay, seconds. Okay. And so we'll do a we'll go roll call.
No
Vote.
George this
Mhm.
time, right?
Steve,
Yes.
okay,
yes.
Mark,
Yes.
Bob,
Yes.
Ashley,
Yes.
me, yes.
George.
As
Oh,
presented,
George
correct?
Presented.
Okay.
Oh, that's right, George.
Well, George can't.
And
vote,
I
so-
have to step.
All right.
The table cut me.
That's good. Now we're gonna go to local health maintenance fund, the 1168.
It gets easier.
Meeting injury.
So-
Okay, these ones are easier.
Yes.
That was the hard one. Yeah.
Local health maintenance is tobacco settlement money. We get 72,672 a year. That Governor's Commission, that's one of the areas they're talking about upping local health maintenance or trust money to local health departments as a means to fund them better. I don't know what will come of that, but maybe we'll see the money finally increase. It really never has,
That's
so.
a guilt thing.
So this.
Number 46.
I know, exactly. We don't want to do that.
Yeah, so this has typically covered 3 part-time positions. The two main ones that it covered, it was originally the admin assistant when it was part-time. And then the data entry clerk that helps out in vital records. And then we had kind of a sanitarian that was usually a summer pool person. So we want to keep those. What we're really kind of looking at maybe using one of those to provide a few hours of support to our financial manager so that she's got somebody to help her with kind of the clerical copies, that kind of thing. So she can concentrate on some of the bigger things. Yes.
Do we have,
Does the administrative assistant also support the director?
Well, we have a full-time administrative assistant now. That's
Okay.
Kendra.
We didn't want
Yes.
to pull any support.
Correct.
Okay.
Correct. Yep. Yeah, we just thought that that was an opportunity, and if financial manager didn't have anything for them to do, and Lori and Kendra had something else for them to do, they could still be used that way as well. So then this is pretty standard. So we've got, last year we had extra office supplies because we were upgrading our binders for birth and death records,
Right.
and that will be completed. So that's why that's
Those are
dropping
lovely.
back down. Yeah.
Those are very nice.
Medical supplies, again, we don't have much in the way of need for that, but try to put some in there if we needed it. For TB follow-up. This fund, we do a lot with like TB chest x-rays. That's in our services lines. If we had to do some other communicable disease follow-up, maybe we would need things for monkeypox or something like that. We could use those. Education and public information, we've kind of dropped that over time. Training and travel, it's a small amount. We can't supplant. So what we've really used this for is kind of been that national conference. So whether that's a board member going to NALBO or like the administrator going to NACHO, something like that. And then the software is really looking at like our receipt program, complaint system, looking at maybe performance management systems to help us
a lot of
streamline.
those fees, like maintenance fees,
Yeah.
the monthly.
Yeah,
fees,
exactly. We have had the live stories on our website, and that came out of NACHO, so all that demographic stuff, and that was supposed to be a 5-year agreement. That's going away. Something changed, so we've had a call with them. I don't know if we want to keep that, what that cost might be. And then personal health care is where that agreement with volunteers, volunteers in medicine with Health Net is.
Which one has it been? Sorry.
The personal health care. And then it also includes some of our other things like interpreters that we use, specifically in Futures Clinic, but we can use interpreters for other needs that we
So
might
the health, that's
have.
the prenatal program now, right?
Yes,
That's okay.
yeah. Now, we did suggest adding, and this came from that conversation that we had before about going ahead, so HealthNet, right now, their agreement is $20,000, up to 20,000, right? So I was suggesting, it's 15, I'm sorry, 15,000, making it 20. Doesn't necessarily have to go to HealthNet. You'd had that discussion last month about prenatal, maybe Tandem will make an ask or have a need, something like that. So it would be much easier on the department to go ahead and have some extra money in the budget.
Have the line funded so we could use it as
Yeah.
necessary.
Yeah.
Makes
So we're suggesting that the prenatal be 20 instead of 15. And then the other is for interpreter services, lab services, chest
The
x-rays. that we
contract
have.
says 15 right now, right?
Yes. Yeah.
But
Is
the
that
the
what I-
extras are in case they go,
Right.
because there's a boon of pregnant
Right.
people.
And you can decide, so.
Isn't it Latino pregnant people?
Mhm,
Because
pregnant,
I
yeah.
believe it
Yep.
was.
Well, it's
set up
for
for the
people
Lat-
who don't qualify for other reasons,
Yeah.
and most of them are Latino.
Yeah.
I thought specifically it said.
I think it was
When
for
we
people,
talked, when we first talked. about it.
I think back in the
Yeah.
old days, it's been a while since we did this.
Yeah.
It was a long time.
I
ago,
think
right?
it started out as a specific group
I did, but it was, yeah, I think it was,
and then it expanded a
Right.
little
it's
bit.
aimed for people who are not,
Right.
that can't qualify for
Yeah.
other public assistance.
And you may
Uninsured.
be
And
thinking
most of them are,
too,
yeah.
because there was a discussion at a point where there were some students
Yeah,
coming in who had to have insurance
That's right.
and they dropped their insurance and then they were wanting these
But it's for students,
services.
for
And we're like,
students,
yeah, no,
no,
you can't do
no,
that.
no.
Yeah.
No.
So,
Right,
Yeah, and
yes,
that's,
exactly.
that's the
They have to,
conversation
they
where
have to
we
not
had
be.
that.
And we had
For
IU
students.
students who
Mhm.
were coming over instead of going through
Right.
the student health.
Yeah, we had to clean that stuff up.
So,
Yeah, they have to.
Remember that?
That's okay.
Yeah.
Yeah, initially, the volunteers of medicine, well, volunteers of medicine didn't see anyone that had insurance.
Mhm.
So
Right.
the people they were seeing were all
Right.
uninsured.
Yeah.
So that
Okay.
was, I just think it would be easier and so right now we have a contract with HealthNet and it's for up to $15,000. Then you'll be
That's good.
doing a contract for next year. So you could decide
Yeah.
eh, between now and the end of the year, what you want that
Let's
contract
see
to
what the
be.
need is in the
Yeah.
meantime.
Yeah,
So
exactly. See what
I think
the
that
need
it's
is.
an important population to make sure it's funded.
Yeah.
I think we
So,
all-
it
I
saves
think we
us
all
money.
agreed on that
It
one.
saves us
but
money.
yeah,
Yes,
but I
it
just
does.
thought it would be
Okay.
easier to have it in the budget and not spend it if you don't need it,
concur.
rather than us to have to go back and
Okay.
Okay.
make other changes. And that's
Um,
it.
Any other, no other change in local? Okay, this is, we'll entertain a motion to accept this budget as proposed. Please,
I'll make that motion.
Bob,
I'll
second,
second.
Steve, second. And we'll vote on it. Are you ready, guys?
Yes.
Ashley,
Yes.
Steve,
Yes.
Kay,
Yes.
Mark,
Yes,
Bob,
Yes.
I also vote yes. Okay, it passes unanimously.
What a job you
Last
did.
but certainly not least, the local health trust account.
Yeah, well, there is another one. Let's just hit real quick. 4906
Did I
Public
miss that?
Health Emergency Fund.
Okay,
Is that in there?
Where are you?
Well, I don't,
No, missing that one.
missing that one. Well, it's pretty easy. So let me
Okay.
just,
Can we pull it up?
There it is.
I have it on the screen.
Thank you.
So,
You're
some
all
of you
over
have-
it.
yeah, so this is actually local health maintenance funds
We do have some.
that we
for it.
moved several years ago into this emergency fund so that we could appropriate it annually in case there was some urgent need. And we would have funds available even if we had to pay them back. So if local health maintenance fund money wasn't appropriate, we might have to figure out a way to move money around, but we could still handle it in the moment. So that's what that was. That actually started out, for some of you who have been around a long time, as the anti-TB fund. And
That
so,
ran out of money though, right?
well, there's $32.
I
So we
saw
need
that. I was like, is
to,
that a typo in here? I was like,
yeah, we need to change that to add the $32.
okay.
So there is $32 in there. And my point is we need to appropriate it all, right?
Yeah.
And then we
Yes.
don't forget again that it's there,
Right.
right? But the 20,000 is from local health maintenance.
Okay,
Yeah,
right, yeah,
So-
yeah, and that was somebody made a gift or something, right?
yeah.
Yeah, somebody,
that
yeah,
was-
somebody made a gift for that, and
Yeah,
then
that's
finally,
her.
finally ran out.
Yeah,
Yeah,
yeah.
that's right.
I said, oh, yeah, okay,
It was for x-rays and.
Yeah,
X-rays primarily.
right, yeah, so people who didn't have, yeah.
You know,
That was
and
about 40 years ago.
saying that, we could probably
Before I started.
think about when we have a TB chest X-ray that comes up. So Jamie, I know you're listening. The next TB chest X-ray that comes up, we could probably spend down that 32 and then we wouldn't have it. And it would all be local health maintenance money
Okay.
because it all comes out of local health maintenance anyway.
Okay.
So
So,
with that, well, yeah.
So there's no money in the first, I don't understand this up there.
23, it just wasn't hadn't been filled in for some
Okay.
reason. So we are
So it's
proposing,
not, it's just in the wrong place, all the
Yeah.
10,000 should be in the yellow spots, not.
Yes.
Not under changes,
yes,
so that should be moved over, okay.
Yeah.
So pretend like all those yellow things say $10,000.
Except the last.
And the changes one, yeah, and the changes don't exist. Then we'll entertain a motion to approve this budget as it should be.
yeah, $20,000.
Yes.
Yes.
I need a motion, please.
So
Hello,
moved.
Steve,
Second.
Mark. Okay, we'll vote again. Ashley,
yes.
Steve,
Yes.
Kay,
Yes.
Mark,
Yes.
Bob,
Yes.
me, yes. Thank you. That one oops, doesn't show here.
So just,
Okay.
just a quick question on that one.
Yeah.
I'm totally fine with the budget as is. So it comes out of local health maintenance fund, right? Does it come out of the cash balances or coming out of one of these?
It already came out of cash
Okay.
balance when we
All right.
moved it over there. So
Gotcha.
it no longer shows up in that fund
Okay,
at all.
okay.
Yeah.
Thank you.
I just, because we, at the end of the year, when we report on how much money do we have,
Mhm.
we have to remember that that 20,000 is still local health maintenance dollars.
Lori.
Somebody should remember.
Don't you be forgetting that 20 grand sitting there.
If we count on me.
Oh, no.
Yeah, the board will be like,
We can't even remember back to February.
I know. Well, we're all getting older.
Did you make us a summary on that?
Okay, now we're into the local health trust account.
Yes, so the trust account is the other tobacco settlement fund that we have. Flat amount that we get, 54,261.98, right? We still have some cash balance in it. It's not as hefty as local health maintenance fund cash balance, but it would carry us a few years if the money ran out. Right now, it doesn't appear that it's going to run out, so hopefully it will
Yeah.
increase.
Yeah, and we don't spend, you don't use it hardly ever.
Well, we are spending cash balance down. This covers our community health specialist that focuses on tobacco and
Yeah.
MRC.
Yeah.
The real changes here are that typically we have split this salary slightly. We've used our preparedness grant to pay for a couple $1,000s of the salary. And initially we did that because it's kind of that thing, if we take that from that preparedness fund, we can never put it back. But we've not needed to. And at this point, it's more trouble than it's worth for those couple $1,000s. So we would just like to put the full amount. And this doesn't look like this doesn't look like up on the screen isn't the completed one either.
It's not. Looks a lot like this one.
Yeah, but it's got changes. It's supposed to be in the proposed line.
What
So,
number is supposed to be
again,
Oh,
here?
okay.
Yeah, so the salary in this, again, will change when council,
Right.
When they do their.
Yeah.
Yeah.
and so by the end of September, is when we put in the applications for these to the state. So as soon as budget hearings are over, Lori will go in and make any changes that need to be made to that application so that we're applying for the correct amount.
Okay,
But we will be using cash balance. So just know that that could change a little bit as well.
Okay.
There's some money for training and travel, hotspot, and a little bit of, see, this is all kind of in the wrong spots. Personal health supplies are a little bit of money for some NRT that staff had requested. So nicotine
NRT.
replacement
Yeah.
therapy.
Okay.
And we're really looking at how we can sort of change the Baby and Me tobacco-free program, how we can do that. So the state's not funding it now. We're using some previous National Association of County and City Health Officials funding for Baby and Me.
We don't want our babies healthy.
Well, they're doing different programs. It's pricey, but they've got a new initiative. So we're looking to see what we can do differently,
Okay.
but we are using some NACHO funds that we have to keep that program going right now. But the staff felt that there might be a small need for nicotine replacement therapy if we can't get it somewhere else for somebody.
But I do have a question
Mhm.
about the activity of this group. Is that in the past, we've had like billboards and PSAs and things. Where did the money for that come from?
That is more from the coalition. So the Tobacco Coalition,
Right.
and which kind of is run through the hospital, and they did get funded
They
again.
did, because I know that they got rid of
Yes.
people that stayed. They
Yeah,
completely
so-
dismantled the whole thing.
Yeah, they
Mhm.
went through a lot of changes. So
Yeah.
that's now at the Department of
Now we have
Health.
opioid money, won't we? Won't we have opioid money?
Opiate money?
Yeah, there'll be opioid money
Yeah.
as well. So that's what they're looking to use to help IRA with the
Yeah.
space.
Yeah.
So they did get funded this year. I haven't seen the budget. I mean, that goes through the hospital, so I haven't seen it. Shauna, that's something we could have Shauna come and report on what's
I'd be
going
very
on with
interested
that.
in kind of what's going on with a lot of
Yeah.
that. So if you look at the numbers, so because you have it's 52,248, is that the total proposed number?
And with the exception that salary and
May
fringe could change.
Because that's
Yeah.
less than what the amount we get. Couple $1,000 less than what amount we get. It's
That's-
54,261.
Hang on a second, because that can't, that's,
Says we get 54,261 a year, and this is 52,248, so there's a
okay,
couple
so that's not,
$1,000 difference there.
yeah, hang on.
The reason I asked is there something we could be doing differently?
We're spending more, so that is not right. Hang on.
Okay, so that number's not right. These numbers are
So
kind
they
of
get,
messed up
you
here.
guys get 54,
This is what I had off the computer, does that help?
but what we're
Yes,
spending
that does, and
52.
that's
Is
what
that-
no,
is
we,
that our question?
I guess my question is, if there's extra money
that, yeah, what you're looking up there, the total is not,
that's
the
not right.
total is not right.
That's not right.
Yeah,
Okay.
I don't know what
248,
we're
okay.
looking at, but hang on. Where's my trust account?
Yeah, this is kind of. Things are in the wrong place here, so.
Yeah.
Okay, so, well,
I guess here's my concern, if I figure that out. Is this something we can help the Tobacco Coalition with? I'm just,
well, so
I guess it's because the state's not doing stuff anymore, and it's all basically been turned over to
Right.
local.
the total on there shouldn't be 52, it should look like 62.
Okay,
So because I have down, the difference would be 9,885.58.
yeah, this math.
So
is
we,
different.
the salary,
Okay.
so the salary is 43,589. And that's what it is now.
Okay.
The salary that was there was showing it less than full because we split it.
Okay,
And then the FICA should be like 33, 35. See what happens in, and perf 6190.
okay. That makes more sense now.
Yeah, so now you've
Yeah, okay.
got
66,000.
66, yes.
Okay, I guess, but it does come to the question about whether we should be thinking about if we need to do any other tobacco funding for the coalition or something. This is the states can't drop the ball on it.
Yeah, I think what,
We can
well,
talk about that later.
yeah, I don't, the coalition did get money this year.
Okay,
So they have been funded. They do still meet and they are doing various things. We could,
I guess maybe
I
at
mean,
another meeting, I'd like to hear what's going on.
yeah,
with
so I
our
would
tobacco
just have
education.
Shauna come and
And-
do one of the public health reports, but have her focus on not only what she's doing with tobacco, but what the coalition
Yeah,
is doing on.
I just feel like that,
Yeah.
with all the codes, we can't drop the ball on some of our the
Yeah.
tobacco issue particularly.
Right, I think that some of their concern is, again, to go back to vaping.
Yeah.
Yeah.
We haven't really done anything the last couple of years with any of that, which we were really going strong on there for a while.
Yeah.
And so I don't want to make sure that we kind of get back to normal.
Yeah.
I guess
So
it's-
my apologies for that. I'm not sure quite, is that
it looks-
more what
it
you
looks more
had?
like what it looks like.
No,
Well, you had the,
yeah, I had that.
right,
69 was my total.
I think it's
69.
480 to 1500.
66.
okay, so in what you got sent to you, so this is probably what,
Looks like the four, on the 30,014 and 30,028. Those numbers you moved over into the yellow column as well.
yes,
Then I think you're
yeah, the
okay.
480 and the 1500.
Yeah, move that, then I think
Oh,
then I think
right.
it looks right, if you do that.
Oh, but you still had you had 69. Yeah, Kendra can, yeah,
You move the 480
move
to
the
1500.
480, keep coming down.
Other services and training travel.
Like 30, 14.
There you go.
Yeah, that one. And then that one, there you go.
Yeah.
So that looks right, yeah. So that's the numbers we're talking about, right?
Yes,
Okay,
and
so
it
your
could,
salary-
the salary may be higher because,
course.
but yes, that should be,
Okay. That's what we're gonna vote on then. What's up there, right?
yes, knowing
Okay.
that salary and or fringe could change,
Change,
but
of course.
the fringe should not change, but the salary will.
Okay.
Yeah.
All right. That is what we want to. So I need a motion to accept the budget as up on the screen up there. I need a motion, please. Somebody.
I saw
Thank you, Kay. I need a second.
I'll second.
Ashley seconds. Okay, we need to vote now. Ashley.
Yes.
Yes.
Kay.
yes.
Mark.
Yes.
Yes.
I also vote yes unanimously. It passes again.
All right, great. Thank you. Sorry for that confusion. Thank you, Kendra, for adding
Yeah, thanks
those
for pointing that out.
in there.
Okay. Our
And
Last
thank
thing,
you for bringing what you had
we're
printed out.
done. We're done with the budget. That's so exciting.
I know, right?
We need to schedule board meetings. How often do we want to meet? What would make you happy, Lori?
Well, I think extending it a little.
Okay, I'm good with that. I don't know that we want to go back to every 3 months quite yet, but maybe.
It's not immediately.
Yeah.
Well,
Like-
we
We can
were.
always add more meetings. It's
Yeah.
not, it's not an issue.
Yeah, we were talking, so my recommendation, Lori has budget hearings in September. She has Indiana Environmental Health Association Conference. She's got National Incident Management Training, and she has local health maintenance due at the end of September. So I would suggest, unless there's
What's
something
urgent?
urgent, but we will have things ready for you with the code, with the fee code. So we were thinking that if you met in August and then maybe in October, that would make sense. And then if you felt like you needed to meet before the end of the year, you could, but we were kind of thinking
6 weeks out.
August
would put
and
I was thinking
August
6
and
weeks
October.
myself. So we're talking about the end of August here.
Uh,
My phone decides to work. Oh, come on. It's having a bad
August
day.
25th.
August 25th would be 6 weeks out.
Okay.
August 25th.
Okay. Works
Why
for me.
anything?
Everybody good with that? George, you good with that? Are you there, George? George,
Yeah.
you're muted. George. You're good with that way?
It's good for me.
Okay.
4:30.
4:30?
I like 4:30. I love 4:30.
I know, we bullied Tom out of
And then your October meeting then?
Okay, I
Or
will
would
be
that-
gone. I'm just gonna let you
Yeah.
know, this doesn't affect, as long as everybody else can be here, but I will be out of the country until October 20th.
I will be in South Carolina, which is fine. I can do it on Zoom, but
And I'm gonna be going in October, but I don't know when yet.
I would love to do October
I think
13th
mine's
personally.
the first. I think then I'll be gone.
Where are you gonna be? Find someplace fun?
Italy.
Ooh, nice.
Well, I've got a 40th wedding anniversary coming up. here,
that's
so-
wonderful.
Wow,
That's nice. I just had my 50th. I'm not old enough to have my
Nice.
50th. I'm
I
sorry.
had a starter marriage.
Yeah.
So I
Is it
heard
40
October
over 40?
13th.
I could do the 13th and I would be here, or we could do it on the 20th. I cannot do the 20th. I could do the 27th, but I would be in South Carolina. I'd have to be on Zoom. I have one of those.
I'm
What do you guys,
looking and seeing that the 13th is Saturday.
October?
No, August.
No,
No.
I thought you were talking
I'm talking about
August.
October now. We already did August.
October when, 20th?
October 13th.
I cannot do the
That's a
20th.
Thursday.
It's a
That's a
I could do the
Thursday.
13th or the 27th.
Go down the 13th?
Well, and then Steve could do the 27th, but he cannot do the 13th. I can only do the 27th. I have to do it on Zoom though.
I'd rather have you in person.
Oh, thank you. Shall we do it the
That
13th?
helps make a decision.
I'd rather be here in person too.
Yeah.
We'll-
So
we'll-
can
we
we do
could-
the
We can
13th?
struggle.
Does it
on
bother
without
with
Steve, maybe.
anybody else?
We'll struggle, but
It'll
we
be
can
a
struggle.
struggle.
We'll struggle.
Any of those three are okay with me.
Okay,
Okay, we'll do
13th.
13th. It is.
All right.
So August 25th, October 13th, 4:30.
And if you feel like we need to do another one before the end of the year, we could discuss it then. Okay. Good for you?
Yeah, you can always call an emergency meeting if something
Yes.
happens. You 48 hours and you're good.
We
And
have
then
done that.
one
Yep.
quick question, when is your budget hearings again? Just for
They are in
reminder.
September and we don't have an exact
Okay.
time yet,
You'll
so
send them
Lori
out
will
when
let
you-
you know.
Yeah,
Yeah, we
Lori.
requested the 7th or the 8th. We did put in a
Okay.
request because of the stuff that she's got on her calendar.
Okay.
It's whether or not they listen to us.
And so next time we do fees. Anything else we're doing particularly next time?
They're gonna give an update on the CHIP event.
Yeah,
Okay.
Shauna here. and-
Uh-huh,
All right, you'll
And
talk to me before the meeting, so. I'm sure.
So
Yeah.
we'll go over, we've got a few things to do tomorrow, but we can talk a little bit about
Okay.
if there's anything else that might need to be on the agenda, and then you all will, if there is anything, just holler.
Yeah, that'd be fun to hear from IU again next time, just because.
And Kirk said
Schools get
that,
ready to
yeah, he
start,
said he'd
so-
be willing, you know,
I think
that
that might
things
be a
were
good thing
pretty
to do.
steady for them at the
I'd love
moment.
to
So
stay, but I have to go.
grab one of those little baggies up there. All right, so is the meeting adjourned?
Yeah, you gotta adjourn the meeting.
I don't,
Good
we
job,
gonna adjourn
folks.
anybody?
I move that we
Okay.
adjourn.
All right.
Second.
Great.
Second.
Okay.
Second.
We don't need to vote on it.
Thank you, everybody.
Thanks, George. Thanks, guys.
Thanks,
Lee.
Joyce.